say your name and what is your job title?
I'm David Nicholson. I'm a certified and registered nurse anesthetist, or CRNA.
Okay. My name is Anthony Fair, and I'm interviewing David
Nicholson.
Nicholson. All right. What made you interested in healthcare?
I was always interested in the topics that we discussed, like anatomy, physiology, pharmacology, and the appeal of being of service to patients was also something that interested me.
Why did you choose this career?
Specifically anesthesia. I had a friend who was I was in undergrad school with, who was interested in becoming a CRNA, and I pursued it sort of in a stepwise fashion with him, and then as the more I learned about it, the more it seemed like a good fit for my skills and interests.
What do you do in your day-to-day life?
In my day-to-day work life, I'm usually up at 5 o'clock. That's when my alarm, my alarm goes off at 5 o'clock. I'm usually up shortly thereafter. Spend some time doing a little personal physical fitness at home, and then come to work. Usually here at work by 6:30 with the intention of starting cases at 7:30, which is pretty typical of operating rooms. I come to the operating room and I set up my workspace, do a machine check, log on to the electronic health record, access the supply cart, and set up everything for the first case of the day. And then depending on the type of case and the schedule, just continue taking care of doing the cases as they come and resetting up between cases for the next case.
What was your greatest accomplishment
here? Here specifically at this hospital, or just in my career?
Just in general.
I would say finishing anesthesia training was probably the greatest accomplishment.
Did you do like a master's or a doctorate?
When I went through training, the programs were all master's level programs. The school where I trained, the curriculum didn't change at all. They just did it. They just changed the degree. So I did essentially the same amount of training, but mine was master's based because I graduated in 1997 from anesthesia school.
Oh, so you've been for a long time.
Yeah. Mm-hmm. Almost 30 years.
Hey. What was your most proud moment, like in the OR?
There've been a few. There's been a handful of cases that I could say that when I was involved in the patient's care, it made a difference. Not that I'm unique in that way, but just cases here, and specifically here when I first started here, and then some other very unusual events that occurred that I was able to participate and make an outcome be way more positive for a patient. When I say these things, they're hard to construe in your mind when you don't have a context for it, but not every day in anesthesia is life or death. Anesthesia, there's some kind of humorous ways to express what anesthesia is, like it's 99% boredom and 1% terror. Most of our days are routine, and the thing that you will learn to want to have in the course of your daily life is routine, boring cases, because that means there's no the patients aren't having any bad outcomes or reactions or any issues with the surgery or the anesthesia. But when there are those instances and you can intervene and use your skills and training to help a patient's life be saved, then it's very rewarding.
Do you wish you did something else?
Depends on the day. I would say that's a kind of a yes and no question. Anesthesia and healthcare in general it can be challenging and in particular when you're first starting out in a career like this. I think you feel pressures that are hard to not feel, because you're new and you're maybe appropriately still practicing your craft in a very, I wouldn't say you're not confident, because when you come out of the training program, you're probably very confident, but it's a very dynamic environment. And my advice to anyone is to seek out the counsel of people who have been doing this a lot longer, and see what it is that is important and valuable to them, because the things that are important and valuable to me now are very different than they were when I first started. And just an example of that, a lot of ORs and places that you work you will feel pressure to move through your day, get the cases done, and everybody wants to be efficient and do a good job and get the work done. But sometimes that translates into pressures that make you feel not as though you're not able to do your job the way that you feel most comfortable doing it. And those things are just hard to navigate, I think, when you're first starting out in any career. Not sure if that answered the question or not.
It did. Yeah, because I have like 3 things I'm choosing. I'm trying to struggling to decide, like CRNA, because I know I want to do medicine. Okay. And I know I want to be in like maybe anesthesia.
Mm-hmm.
So like there's anesthesiologist assistant, CRNA, and like natural anesthesiologist.
Yes.
But like it's hard to choose all 3. Like between those 3, like I know the schooling is different, I know the materials are different, but like it's just difficult to choose. So that's why I'm like, you, for example, like get more insight of it and see what I want to do in the future.
Yeah, anesthesia is unique in that regard, because, and this is another, I mean, it's good that you're aware that there are those 3 different pathways to anesthesia. And as you can imagine, 3 different ways to become essentially proficient at the same skill and have the same job creates some inherent conflicts and competitions, and that is a real dynamic in the world of anesthesia, in that it can create difficult work environments, and I've experienced those things. But there are also jobs where all of those providers work in concert, and they all work together. They're all part of the same department, or same team. But yeah, there are some unique things about anesthesia that set it apart. And there's some real choices. I mean, anesthesia training has gotten way more expensive in some places, but compared to medical school and residency and all of that, I think it's still a lot cheaper to go through anesthesia training. The job choices and career choices and practice, ability to practice to the full scope of your license are way more available today for CRNAs, just because of the supply and demand issue. But and you're even less, so you have less freedom, the least amount of freedom to practice in all the areas of the United States as an AA, because of the laws of every particular state. You can practice in every state, you can't necessarily practice independently because of the group that you're working for as a CRNA. As an MD anesthesiologist or DO anesthesiologist, you have probably the greatest degree of flexibility. Yeah, I mean, there are pluses and minuses. I couldn't, if I was in your shoes, I would probably struggle with the same decision, what path to take.
It's because for AA, I know that some states don't allow for them to practice, and I know it's hard to find states that like see an AA as like a, how do I say this, like an actual assistant, I guess. While CRNAs, they have more states to go to pretty much, and there's always jobs around, like travel CRNAs, and then there's also just like more opportunities. But I know like the schooling is more hard too. And then they're all, I'm not one of these, but like I like just the traveling part mostly, like being in other states and seeing people from other areas and different cases from those areas in one place,
Yeah, I would say, I mean, if you narrow it down and you know that you want to do anesthesia in healthcare, I would choose between CRNA and anesthesiologist, and solely for the reason that you will have way more flexibility in terms of where you can live. You know, if you wanted to stay in a small town, like here for instance, there are no anesthesiologists, so you could not have an AA. There aren't any AAs in the state of Idaho, but even if there were, because there's not an anesthesiologist here to be a supervising physician, you couldn't work specifically here at this hospital. And that's true in the overwhelming majority of hospitals, because there's so many rural hospitals that don't have anesthesiologists, or if they do, they don't have they're not set up to have a practice model where you have an anesthesiologist supervising AAs on a daily basis.
I haven't thought of that. Like, if there's an anesthesiologist where they're supposed to be present, like they can't practice at all.
Correct.
I haven't thought about that either.
Yeah.
And then for CRNAs, I know in rural areas, yes, in practice, but like only to a limited scope of practice. Right?
So you can practice to the full extent of your license in every state in the United States. The determinant of that will be what is the model of either like here we are not employees of the hospital, we're contractors through the group in the group here, and we are credentialed providers with the med staff, but we're not employees. And so here we practice to the full extent of our license. In other places, in other hospitals, you can still practice and do all the things you do here, but pragmatically, the group may be set up so that as a CRNA, you are primarily in the operating room, and an anesthesiologist is doing the pre-op and the post-ops and performing any nerve blocks and doing that kind of stuff. And so it's more of just a division of labor for the sake of efficiency, but it results in you doing fewer things like nerve blocks, for instance. And so, yeah, it's variable just depending on the way the practice is set up. Is it set up to be a supervision model or a team model where you work in concert with anesthesiologists? I've worked in pretty much every kind of model you could dream of. I've worked in a model where it's an MD and they're supervising 3 CRNAs in 3 different rooms. I've worked in a model where it's MDs or anesthesiologists and CRNAs, and we all do our own cases in our own rooms. I've worked in models where it's only CRNAs. I've worked in employment team models, contract team models. So there's all kinds of different ways that people will set up their practice, and those are the things that you, as you go looking for jobs, will want to evaluate and say, okay, what is this going to look like on my day-to-day basis? What's important to me? Is it when you're going to be starting a family and you want more time at home, and say, yeah, I could work in a team model, and I'm not responsible for all the other stuff going on, and so I can work a set schedule. I can be home with my family or young children or whatever it is that's on your plate at that time in your life. So there's lots and lots of different ways that the work life is set up.
I found any like models and like what's it called? Like the teamwork one you're talking about, and not even know there could be multiple CRNAs in this room too.
What's that again? Say that again.
I didn't even know you could have like multiple like CRNAs in one single room. Like, is it if it's like it's only if it's like a complex?
So what you may, yeah. So usually it's one anesthesia provider per operating room, and there are occasionally cases that require additional hands if it's some emergency or whatever. But what I was saying is that in some models you'll have an anesthesiologist and they'll supervise multiple CRNAs. The most you can do at any time is 4, and so there'll be, say, if there were 4 rooms here, and if it was a team model in an operating room like this, you would have 1 physician and 4 CRNAs, and the CRNAs would predominantly be doing the work in the operating rooms.
Mm-hmm. Do you have any regrets in this career?
No, not really. there are a couple of job choices that I probably would change if I had to go back and do that. But you learn with every experience, and I think the thing to do most of the time is when in healthcare you will likely experience where you go into a situation and you thought your pay was going to be one thing and your work schedule was going to be one way, and then things change because a hospital decides to do something differently, or a group decides to not be an independent group and they all become employees. And so as those things happen, just take them as they come. Don't panic. There's always going to be work for you in healthcare. There's always going to be work for people that do this stuff. No matter how good AI gets, you still need somebody to be hands-on doing this stuff. At least, I would say, at least for the next 100 years, there's not going to be anybody that will take the place of an anesthesia provider providing anesthesia. There may be adjuncts, but there will be plenty of work. There's always work for you. And when the normal peaks and troughs and waves happen in life, just take it in stride and don't hit the panic button. If a job's not meant for you, learn that you can move on for your own well-being. Because sometimes I stayed in jobs because I thought I had to, and I should have left because they were not good working environments. So, the healthcare, well, any job is, there's no job, there's no anything that will be just rock solid stable for your whole life. But healthcare, I think, is in particular kind of tending towards a little bit more upheaval. But you and me personally, looking back, would I change something? Yeah, I'd just be like, hey, no biggie. It's going to work out because it always has.
What was the last last stressful operation you thought of? Like, what was the most stressful?
Oh, the last most stressful?
Yeah.
What was the most recent stressful or the most stressful? Oh. How in the world?
I know
That's hard to.
I know because of HIPAA laws, you can't say much about the patient information. But
well, yeah, I can tell you a lot about patients and experiences because as long as you wouldn't know any way to identify them, but it's hard to narrow down. I mean, there have been so many cases along the years. Some stick with you for good reasons because the patients were it was a very positive encounter. But yeah, there have been some stressful cases. Any big surgery that is going to be done on someone who is not healthy, those things are stressful because you end up having to manage a lot of their core physiology with the medications you give. Their blood pressure can be up and down, their heart rate can be up and down. You can have difficulty with their oxygenation and their ventilation and gosh, I don't know if I could pick one, but yeah, generally it's the cases that are complex cases on very sick patients. I'd say one that kind of sticks out in my mind. There's a disease called there is a abnormal growth of your adrenal gland tissue, and it's called a pheochromocytoma, and it produces vasoactive substances, which makes your heart rate and your blood pressure go sky high, and then it can go super low. And doing those cases, which I've only done probably 3 in my entire career, are very intense and very stressful because anytime the surgeon goes to touch the tissue, it can release vasoactive substances. So you're turning on medicines to support their blood pressure 1 minute, and then you're turning on medicines to bring their blood pressure down the next minute. So
it sounds like you're just fighting with a little blonde, right? Like from change it up and stuff.
Mm-hmm.
How do you feel about the job? Like in general, like how do you feel about being a CRNA?
I feel good about it. This is a good place to work where I'm working currently. You know, no job is perfect, and there are always challenges or ways to improve and things of that nature. But I have a very good group of colleagues here, and this is a good hospital to work in. It's a well-run system. We have very few issues with beyond just the normal challenges of taking care of patients.
How do you feel about the responsibilities of this job? Because I know, like you said, in a CRNA model, that you're the primary anesthesiologist leading.
Mm-hmm.
So you're responsible for most of anything that happens within anesthesia.
Mm-hmm.
How do you feel about the responsibility of that?
It's good. You know, there are places like here that are exceptional in that regard because the system is set up to support your job, to make sure the patients are adequately prepared for surgery, that any issues have been addressed, that are issues that would put the patient at additional risk, if they have heart issues, if they've been thoroughly evaluated. All of that stuff is done very well here. There are places where it's not done well, and so when that's not being done well, it adds to your stress. So it's fine. And over the course of years, I'm more confident in knowing how to navigate the systems that are a part of what makes my job and workflow work well, and I'm able to be involved in helping give guidance to those things.
I'm gonna stop this real quick. I'm gonna redo it because I'm gonna do a second video for the other 10.